we've already solved some questions on the subject. So I'm just going to re-emphasize on some things. And then when we get to management, we will stop, go solve questions, and then come back. So if you know your management of ADHD, get yourself together because we'll be solving questions on that. Now, ADHD is a neurodevelopmental disorder, and it manifests in childhood with symptoms of, and we talked about it, hyperactivity, impulsivity, and or inattention. Okay, that's ADHD for you. These symptoms significantly impact, and so ADHD can impact various aspects of the patient's life, like the cognition, like the academic life, like their behavior, like their emotions and their social functioning. That's ADHD for you. Now, one other thing, I should have dropped a question on this, but I didn't do that. So, who is it commonly found in? ADHD is commonly found in males as compared to females. Now, there was this thing we learned, I think one of the doctors read a question on the impulsive type and the inattentive type. Remember what are some of the impulsive behaviors patients with ADHD show? Can someone let me know? We talked about some of them, but I just by way of revision, can you help me? What are some of the impulsive behaviors that someone with ADHD presents? We looked at it in one of the questions. Please, doctors, who can help me?
Difficulties in social interaction is one of them.
Substance abuse, substance use.
Substance abuse. What else?
Risky behavior.
Like what? Like what? We talked about some of them.
Like intruding into other children's activities.
Sorry, I didn't hear you.
Okay, intruding into other children's activities.
Intruding
they
into
interrupt other children. Yeah, they interrupt other children.
What else?
Blotting out answers.
Reckless driving.
Reckless driving, blotting out answers, right? Impulsivity. Okay, what about the inattention type? What about the inattention type? What are some of the examples of features there? Inattention.
Daydreaming.
Daydreaming. Good. What else?
Forgetfulness.
Sorry, doctor.
Forgetfulness.
Forgetfulness. What else? Sorry? Inability to complete tasks. Okay, so now I'm very glad that we are taking our time to break it down. So there's the hyperactive impulsive type and the inattentive type. And you realize that the inattentive type, the male to female ratio is 2:1. And the hyperactivity impulsive type, it is 4:1. So it is likely to see a male patient with ADHD gambling, doing reckless stuff as compared to a female, right? Like you see it in female patients as well, but the ratio of males doing that is higher. Okay, good. Next, what are some coexisting conditions that can go with ADHD? Very important. Number one, they can present with oppositional defiant disorder. So ADHD can go with oppositional defiant disorder, right? So, and usually, which class of people under ADHD have the oppositional defiant disorder? Those who have the combined hyperactive impulsive presentations. What about conduct disorder? It's associated with increased risk of antisocial behavior in adulthood. So what are the coexisting conditions? Which are the conditions which can exist together with ADHD? Oppositional defiant disorder, conduct disorder, anxiety and depression. Okay, and the anxiety and depression is more common with the inattentive type. So please remember that oppositional defiant disorder is more common with the hyperactive impulsive presentation, while anxiety and depression is more common with the inattentive presentation. Depression increases the risk of suicide. So if you have somebody with a combined hyperactive impulsive presentation and inattentive presentation coupled with depression, that can be very dangerous because they are at risk of doing bad things to themselves, right? And then learning disorders. Can you imagine this child cannot focus, this child cannot keep the head straight, so they have a higher prevalence of reading and written language disorders. Now, what are the genetic risk factors of ADHD? There's a strong genetic component, about 75%. So at times you may have parents coming to your consulting room saying that, doctor, these are my symptoms. My doctor has started me on ADHD medications. And then I can see that in my child as well. All right. Increased risk in first-degree relatives. Multiple genetic variants have been identified. Now, what are environmental factors that impact on ADHD? Number one, if the kid has already been diagnosed with ADHD, but a kid is not getting sufficient sleep, insufficient sleep, that exacerbates ADHD symptoms. And you realize that sleep disorders are common in children with ADHD. Number two, prenatal and early childhood factors. So when maybe the mother was pregnant with the baby, the mother was smoking tobacco, prematurity, low birth weight. These are all linked with ADHD. So doctors, please make sure that you are learning these principles very well. What are some pre-birth factors which can contribute to ADHD? And inconsistent associations with prenatal alcohol exposure, head trauma, and multiple anesthesia exposures. However, the ones which are more consistent associations are prenatal tobacco exposure, prematurity, low birth weight. These are associated with ADHD.